Most people will suffer from low back pain at least once in their lives. But the older you get, the more likely you are to suffer. Just ask our next guest.
My name is Donna and I'm 58 years old. My entire life I've been very active. About a year ago, I all of a sudden developed excruciating back pain to the point where I wasn't even capable of getting myself to the bathroom. The pain was at times stabbing, other times throbbing. Forget about walking long distances anymore. I need a cane. When I attempt to go across the room, I have to stop every few steps and flex my body because it is so painful. I have two solutions that the doctors have given me: to stay on pain medication and muscle relaxers, or to have invasive surgery. And I'm not able to give up a year of my life to do what they are suggesting for recovery. I have other responsibilities besides myself. I have a dad who is 87 years old. I have a husband who has medical issues, and I need to be able to be there for them. The constant pain has been very debilitating. It's made me depressed. I would like to feel my age. I want my mobility, my life back.
You know, understandably, Donna put off having back surgery. She was worried about the long recovery after the procedure. That is, until she heard about a new technique that was much less invasive with a much shorter recovery.
Donna suffers from spinal stenosis. The typical treatment for this is a spinal laminectomy, which requires a large incision and approximately a year of recovery time. Today, we are going to do a mild procedure with Donna. Mild stands for minimally invasive lumbar decompression. The actual procedure takes anywhere from 20 minutes to an hour. Now, all this is done with local anesthesia. We'll introduce some dye to the area and we'll see where the epidural space is. And the epidural space is below where we're working. Next thing we're going to do is we're going to make some landmarks on the skin to identify the area. And this is the only thing that comes close to cutting, which is a little stab incision. And from that stab incision, we place a trocar for an instrument to go inside it. This is the rongeur, the bone biter, which is an instrument that's going to take off just a little bit of bone above and below the level that we're working. And we'll do that, take a few swipes in here in order to get some room. The next instrument we're going to use, the tissue sculptor. The tissue sculptor is the tool that's actually going to take off some of the ligament that's causing Donna's problem. So what we did on the left side, we're going to do the same thing on the right side. And that's it. Procedure is done. All I'm going to do now is put a little bit more dye and see if that looks any different than when we started. So after a 20-minute procedure, no cutting, no sutures, essentially a very simple procedure which should give Donna significant benefit.